Hi y'all, it's Dr. Shabby here. So we are back with one of our experts. I have Heather here with San Antonio Birth Center. She's one of the midwives here.
Hello.
All right, so today we're going to talk about midwifery. What is it? Is it an old school thing? You know, there's this Netflix show, The Midwives, called The Midwives. Have you heard of it?
Called The Midwife.
Yeah.
Probably also people have watched So This Is a Being Born on
This Is a
Netflix.
Being Born,
That's
yes.
a big one.
Yeah.
Mm-hmm.
And so we think, is it outdated? Is it old school? Why is it still around? Do people actually use it? And so let's just start with, what is midwifery?
Midwifery. I love that question because there's a lot of different approaches and answers to that question.
Mm-hmm.
So really the midwifery that I think of is just as it goes back to its roots with woman, like literally guiding women, helping them to gain information so that they can make the best decisions for themselves, hopefully based on best evidence and risk factors and benefits of what's available to them.
Okay, so a midwife, I know a lot of people, we kind of had our video with the doula, but a lot of people confuse the two.
Yeah, they do.
So midwives, they're for the baby, right?
They're for mom and baby. So the difference between a doula and a midwife is a doula is a non-clinical person. They are providing 100% hands-on emotional, physical support, and midwives are a lot like that. However, you're hiring a midwife to lead you and guide you safely and healthily throughout pregnancy, labor, birth, and the postpartum period.
Right.
Mind, body, soul.
Right. So you actually get, like, when mom's giving birth, you're the one who's there,
That's
medically
right.
assisting them.
That's right.
Okay, so you guys have a birth center here in San Antonio.
We do.
Yes. How many midwives do y'all have?
We have 5.
Okay, great. And then, so how does that work? So let's say I'm a pregnant mom and I decide I want to go to a birth center. What do I do?
You call us and you schedule a tour to come in where you actually get to sit down in one of our prenatal rooms, which is one of the rooms we're sitting in today. And you get to sit down and ask us questions, and we ask you questions to identify whether or not you're low risk and a good candidate for out-of-hospital birth, because that is one of the significant factors. We can increase safety in an out-of-hospital setting if you're low risk.
So actually, before we go on, low risk, that's one thing I hear a lot, you know, people say, oh, it's not safe to do a home birth or a birth center, but the main thing is low risk. You actually have to qualify to be able to deliver at a birth center. So what does low risk look like? Well, what does that mean?
Low risk means that you don't have asthma that requires asthma medications on a daily basis, that you don't have to use a rescue inhaler every day. It means that you're not hypertensive and that you don't have diabetes that requires insulin. Most people who have gestational diabetes can control their gestational diabetes with their diet. But if you're coming into pregnancy diabetic, you already have knowledge of that and need insulin and need a higher level of care than what we can give you here. So those things at the basics. There are lots of other things that make you high risk, but those are the basic things.
So does a mom who's had a C-section before, is she high risk?
No.
Great.
Her risk is elevated, of course, and she'll be counseled, effectively in that way. But no, she's not too high risk to have a baby with us.
That's great. So not only can she have a VBAC, but she can have an all-natural VBAC outside the hospital.
And the thing that changes for our VBACs is that they're monitored a little bit more closely in labor. We are, listening to the baby's heartbeat more frequently because babies tell us in labor how they're doing. And when they're not liking labor, they tell us well in advance of not liking it.
Right.
So that we can make a really good plan for that family.
Now, when you're talking about monitoring, kind of talk me through the equipment or the technology that you guys have. It's not just come here, pop a baby out, go home, right? There's actual science behind it, and you guys have the correct tools and technology and the medical things that are necessary to help the mom. So what does that look like?
So what's used at every single prenatal visit that you come to, where they put this little Doppler on your belly and listen to the baby's heartbeat, that's the exact same thing that we use in labor. There's some really good scientific evidence that supports intermittent monitoring of fetal heart tones in labor for a low-risk woman. And so as long as she continues to demonstrate that she's low risk, good vitals, baby's been great, her water hasn't been broken for days, wild things like that, then we continue with her as a low-risk mom. So that means that in labor, when she's admitted here in early labor or to active labor, we're going to listen to the baby's heartbeat every 30 minutes. Then as we get closer to transition and closer to pushing, we listen more frequently. And certainly we can listen continuously if we have to.
Right. So then,
And
that's during labor.
Mm-hmm.
Tell me a little bit about the actual prenatal visits. What does that look like?
So when you come for your visits, you arrive and you typically pee in a cup because your pee tells us all kinds of wonderful things about you, like, are you hydrated, or have you had a rough day and you're late for lunch and you need some nourishment,
Yeah.
or all the way to maybe you have a urinary tract infection going on. Lots of different things. You pee in a cup and weigh yourself, and then you come into our prenatal room where we sit and talk. The cornerstone of midwifery care is not quickly doing your blood pressure and quickly listening to your baby's heartbeat and then sending you out the door. It's really about establishing a couple of things: mutual respect for one another, depth of relationship, getting to know you as an individual and your partner. Those are really vital things. You guys got into this together. We have to help you to get out together.
Yeah.
And so, that's really the bulk of your appointment. We spend an hour with each of our families who are coming for appointments here. Yes.
All right.
Yes.
Big difference in a 10-minute appointment.
It is a big difference.
Yeah.
And we find that in investing that time in our families, regardless of their outcome, whether they have a baby here or they have to go to the hospital or they have a C-section, they have built that depth of relationship with people who they trust.
Right. It's got a team. True team.
Yeah.
Okay. Now, you earlier mentioned people come and they can tour the facility.
Yeah.
Now, so let's talk about in general someone who, whether they're here in San Antonio or not, what are some things they should look for a birth center if they decide that's the route they want to take? What are some questions they should ask the midwives or the facility, or certain things that they should be aware of?
That is really going to vary dependent upon the individual. In terms of any birth center, they're going to have access to equipment that can help with an emergency. I mean, that's a big question that we get from a lot of partners that come in here. They want to know, what happens if there's bleeding? What do you do about that? Why do you have oxygen in the room? So, for example, for us here, we keep Pitocin and Cytotec in the building, and we put it in the birth room so that if we have a mom that bleeds more than normal after a birth, that we can use medications to help control it. We can give an IV. We don't require IVs, but they can be helpful in labor to help give you the energy to finish, and they can be helpful after you've had your baby.
Right.
So we have things like that I would recommend that people ask about and are aware of. Oxygen occasionally to give a mom. It's rare that we have to use it, but we have it if we need it. They should be aware of whether or not the midwives at that birth center are trained in how to help a baby breathe when they're born. It's called neonatal resuscitation, and we all go through this process every 2 years to train, and we do regular drills here as a team as well. And that's something that I would want to know about the midwives that I'm working with. How are they going to respond in the event
of an emergency?
Yes. Yeah, truly.
Okay. So your team specifically, you guys have 5 people.
We do.
Do people get to pick their midwives? Do they interview? Is it whoever's on call? How does that work?
So for our specific practice, we want our clients to meet all of our midwives, because really and truly we can't make any guarantees or promises, and we also do occasionally take time off to honor ourselves and our own families who want this. Yes. So our goal is for our clients to meet all the midwives. They are assigned, every birth team is assigned, so it's 2 midwives and a student. And we generally collect the preferences of each client and try to make that team possible for them within reason. And that's how that works. So by the time they get to about 36, 37 weeks of pregnancy, they'll have the names and phone numbers of their midwives, and those midwives will be on call for them 24/7.
24/7. Okay. So
until they deliver. So from 37 weeks up to 42 weeks.
Okay. So usually patients go past 40 weeks.
Yes, they do. Usually, especially first-time moms, they go to that classic 41 weeks and 3 days. We can absolutely pull up data to support that.
Yeah.
Most moms go well past their due date.
And that's kind of nice, the clock's not ticking, right? We don't have
or
hurry up, get baby out.
And that we know that it's normal, that we're not sitting there getting nervous that 41-week mark hits, and we're like, well, we have a few more days. And 3 days, 7 days in baby time is significant. Those are big days for babies. Not for us on the outside.
Yeah, of course. Okay, so now let's say I come here, I give birth, baby comes out, everything's good. Then what? When do I go home? How long do I stay here?
There's a lot of things that happen in the postpartum period, especially that immediate period. It's tumultuous. You just gave birth to a baby. You just received your baby. You're not sure what to think.
A lot of emotions.
A lot of emotions, a lot of overwhelm. And so there's lots of things happening, right? You have to birth a placenta, and your bleeding has to be normal, and your vitals have to be okay, and you need to eat well and get up and walk to the bathroom at some point. And so we want to really take our time with those things.
Yeah.
You know, you might tear, and if you do, we can put that back together. And so we want to do that in a timely manner and give you time to rest. The same thing with baby. They just had an experience too.
Yes.
So they need to be on mom or dad and just taking a moment and getting to know their new world and getting used to all the new sounds and touches. And so really that happens over several hours after birth. Typically, I'd say that most of our clients are stable and eligible to go home between 2 to 4 hours after they've given birth.
Wonderful.
Which is fairly quick.
Yeah.
Remember though, we are serving a low risk, very healthy population who've taken excellent supplements during their pregnancies. They have exercised, they've treated their bodies well and eaten well. They've seen chiropractors and they have doulas. Like they have this whole team of support for them, mind, body, soul, that really makes for a healthy postpartum. So they're eligible to go home 2 to 4 hours after they have their babies. And then they can stay up to 6 hours after that stability point.
Okay. And then they go home. That first visit, what does that look like? Do they come here for checkups?
No. We don't want our moms getting up out of bed
Yeah.
a couple days after they have a baby. So we go to them and we do a 24 to 48 hour visit.
It's great.
I know, it's amazing. I loved it when I had my babies.
Of course, you're half asleep, don't know what's happening, lose track of the days.
You're leaking from everywhere.
Yes.
So when we come, we are coming to check on mom
Okay.
and make sure breastfeeding is going well, make sure that she's emotionally doing well, uterus is okay, bleeding's okay, and if she had a laceration that needed a repair, that is still doing okay and there's no signs of infection. Then for baby, very similar things. We want to make sure nursing is going well, the latch is good. We do normal newborn testing, so if you're a family that is doing newborn screening, which we very much encourage, then we'll do it at that visit, that 24 to 48 hour visit. And we do a heart screening as well. And a heart screening is just this little simple test. It's a pulse oximeter. It's actually a foam band that gets wrapped around their hand and their right foot, and it tells us how their blood oxygen is doing. It needs to be above 95%.
So you check on mom and baby.
And baby, pretty thoroughly.
Great. Now, at what point does a patient get released from your care?
So they actually get released from our care at 6 weeks postpartum.
Okay.
So after that 1 to 2 day visit that we go and do in their home, then they come here for a 2-week visit.
Okay.
And they come for more frequent visits as needed. So if breastfeeding is not going well, or we need to do weight checks, or emotions, anything, we can schedule moms more frequently. But they come here for a 2-week visit and then a final 6-week visit.
Okay, wonderful. All right. So what is one takeaway message you would like to give to any moms watching, any future moms, anyone thinking, is this right for me? Should I do this? Is the approach I should take? What's an advice you would give?
I feel very strongly that no matter where you give birth, whether it's in the hospital or how you give birth in the hospital or at a birth center or a home, it doesn't matter. However you do it, I care that you have asked questions, that you have access to the best information possible, that you have a team of supportive providers no matter where you're birthing. It's really, really important.
Informed consent.
Informed consent, autonomy, woman-centered care,
Yes.
and that can happen in multiple places.
Yes.
It can happen in a hospital
Definitely.
setting. I've seen it over and over again. We see it when we have to take our families in. We go with them. They're still getting woman-centered care. You know, and that's really where my passion is, that people are making the best decisions with the information that they have available to them.
I love that. All right, sounds great. Thank you for being here with us. We'll attach your information along with the video. So if y'all have questions, reach out to us or reach out to them. Thank you for watching.
Thank you.